Walk with me as we take a broad-ranging tour of the world of cannabis, from the ancient to the modern, the medical to the recreational, as well as the social, cultural, and political landscapes of this fascinating plant. I am Dr. Jake Felice, and this is the Cannabis Matrix, where cannabis science meets cannabis culture, where recreational meets medical, and where the body's own endocannabinoid system is as much a player as CBD or THC. Welcome. Hi, and welcome to the Cannabis Matrix podcast. Today we are going to talk about cannabis and NSAIDs, NSAIDs including aspirin, things like ibuprofen, Aleve, Celebrex, have a very difficult and challenging side effect profile. A lot of people aren't aware of the seriousness of it because so much of the time we are focused on the opiate crisis, but there's also an NSAID crisis in American medicine. As I mentioned before, many different types of NSAIDs, including aspirin, Celebrex, ibuprofen, naproxen, which is one of my favorites personally that I use, Aleve, and many, many others. You can see the list there. And you know, pain is a huge issue in American medicine. So many people are suffering from pain, over 100 million Americans, and it really is one of the largest health conditions that we face as humans, affecting more Americans than diabetes, heart disease, and cancer combined. And it's super expensive, over $500 billion a year. That's just for pain-related healthcare costs. And it is the most common ailment which people use medical cannabis for, largely because cannabis is very effective for pain, or at least I should say moderately effective for pain. And we have so many studies now demonstrating that. Cannabinoids are extremely low toxic, and generally they're very well tolerated. We don't have any reports in any peer-reviewed medical literature in any language ever talking about cannabis overdose death, for example. And if we look at a systemic review of dozens of studies, much of the adverse effects from cannabis are not serious. They usually involve things like sleepiness, that kind of thing. In terms of toxicity, cannabis is super low toxic. It's estimated that the average human would need to smoke 2,000 to 4,000 joints in 15 minutes to cause an overdose death. That's over 150 pounds of cannabis inhaled in 15 minutes, or 10 pounds a minute. And in terms of withdrawal for folks who have been using cannabis for a long time, compared with things like caffeine, opiates, alcohol, cocaine, is actually very mild, short duration, and very self-limiting. And most patients who stop using cannabinoids don't ever need to engage in any type of a formal treatment program. Cannabis withdrawal symptoms are typically limited to sleeplessness, and patients can get some anxiety. Also, night sweats are reportedly common. But I want to talk about NSAIDs today. There is enormous mortality from the NSAID medication. So again, thinking ibuprofen, Aleve, Celebrex. NSAIDs are one of two very major drug classes that are used for chronic pain, the other being opiates. But the NSAIDs don't get as much reporting as the opiates, so I want to talk a little bit about that today. Non-steroidal anti-inflammatory drugs are the most widely used class of medications worldwide and are very commonly used for pain and inflammation. So they're very commonly used, and they also have some very common side effects. For example, adverse reactions occur in anywhere from 1 in 4 patients to over half of all patients taking NSAIDs will have an adverse reaction. So that's a pretty high number, especially in terms of it being such a very common class of medication. NSAID use is increasing over time, and there is a survey here from the Journal of the American Medical Association, the Sloan survey. 81% of participants took at least one medication during the previous week, with acetaminophen, aspirin, ibuprofen being reported as the top three. Now, not as deadly as opiates, but still very, very significant, and taken by a lot of people who feel that the opiates aren't for them because they're dangerous. They'll rely on NSAIDs. Conservative calculations, over 100,000 patients a year are hospitalized just for the stomach issues that are caused by the NSAIDs, and over 16,000 deaths occur each year among arthritis patients alone. So if you're just looking at patients with arthritis, no other condition, over 16,000 NSAID-related deaths just for one disease vector, or rather, I should say, type of disease. If we were to calculate the deaths from NSAID separately, as if they were their own thing, in the National Vital Statistics reports, they would constitute the 15th most common cause of death, right up there with HIV, Hodgkin's disease, and many others. So, as I mentioned, lots of NSAID-related deaths, and interestingly, if we look at how cannabis and NSAIDs interact, we actually is where we start to find some positives. COX-2 inhibitors such as NSAIDs preserve anti-inflammatory effects of cannabis, and also, super interestingly, they reduce cognitive effects and lethargy associated with high levels of THC, so that when you take, as a patient, both your NSAID together along with cannabis, what you get is you still get the beneficial anti-inflammatory effect from the cannabis, but what the NSAIDs will do is that they will reduce the negative effect from THC. So the NSAIDs help the body preserve cognitive function, and folks don't get as tired as they do sometimes when they're just taking high levels of THC in and of themselves. It's going to be a short talk today, but lots of interesting things still. Cannabis and NSAIDs also interact positively in a couple of other ways. For example, if we use smoked cannabis will actually prevent, this is a study, so I'm not recommending that you smoke, but in the study, patients smoked cannabis, they showed a lower degree of stomach irritation, and medical cannabis can protect the stomach from alcohol, from NSAIDs, as I mentioned, and from stress by reducing inflammation in the stomach. And on the line of irritation with the gastrointestinal tract, patients who are taking an SSRI, which is an antidepressant medication such as Prozac, along with their NSAIDs, have to be especially careful because that increases the overall risk of negative events from the gastrointestinal tract. So just to summarize, NSAIDs are the most common class of medication used for pain. They are not in any stretch of the imagination a safe medication. They're not as dangerous as opiates, but they are and do have a very serious side effect profile. Cannabis can benefit patients who are taking NSAIDs in a couple of ways. One is that the desirable effects of cannabis are preserved, and at the same time, the NSAID can help protect against some of the undesirable effects of THC, as I mentioned. And likewise, the cannabis can protect against some of the gastrointestinal irritations that the NSAIDs cause. So I hope you can see that medical cannabis can be a great option for some folks. Continue to listen. Feel free to drop me an email, drjake@drjakefelice.com, if you have questions. I'm happy to answer them. We will be scheduling some guest interviews here in the near future, so I look forward to sharing those with you. And please continue to like my videos, and I appreciate you subscribing. This is Dr. Jake Felice with the Cannabis Matrix podcast. Thank you so much for listening.
Well, it was in my childhood days, oh Lord, many long years ago. Now with the Spirit, now I'm a Savior.